Health services have been partially disrupted, with hospitals overwhelmed across the world due to COVID-19 disease. This has affected patients living with other ailments such as non-communicable diseases. Many stayed away from health facilities due to fake news about COVID-19 pandemic. With increased misinformation and disinformation, nursing mothers and antenatal services registered low turnouts in hospitals. Visiting health facilities in the Greater Banjul area, we realized that despite the pandemic, patients with other health conditions still visit hospitals for their regular medical checkups.
We have a lot of patients coming every now and then on daily basis. But the main fear of people probably not coming to the hospital or low turnout in other facilities probably is because people tend to fear about COVID. When you go to hospital, they think they will be tested for COVID. So probably that can be one factor that is deterring people from seeking health care when they are sick. But that should not be the case. When you are sick, you really need to go and seek health care and let them take care of you.
Bundang Child and Maternal Hospital is one of the busiest hospitals in the Kanifi municipality. The facility is also used as COVID-19 vaccination center. I spoke to Mary Bob, a public health officer, who explained the turnout of non-communicable disease patients at the center.
Actually, to compare last year, when then COVID was just declared as a pandemic, and then people were scared, people had little knowledge on how to prevent themselves, then people were not coming out. But this year around, people are coming out just to make sure that we put emphasis on them taking up the preventive measures.
For parents like Esther Silla and Maimuna Silla, the fear of contracting the virus deterred them from visiting the hospitals during the earlier days of the pandemic.
Yeah, I was so scared. I even asked my husband to stop going to work, neither allowing my kids to go out due to the fear of COVID-19.
According to health experts, people living with NCDs are at higher risks of severe COVID-19 related illness and death. At Bakau Health Center, the management says they employed innovative ways to ensure that essential services are provided to NCD patients.
Those with NCDs, we talk to them. Sometimes we do counseling, like talking to them. We will tell them, okay, if you run out of medications and you don't respect your appointments, you may have complications, and if you have that complications, you may die. So we use COVID to telling them that those with these NCDs like diabetes, hypertension, if they have complications, if they have COVID, if they turn to be COVID positive, it really disturbs them.
As of 4th August, the situational report of the country's COVID-19 recorded 112 new cases of COVID-19 with 884 active cases and 238 COVID-19 related deaths. Jankey On Covid, GRTS News.